right, guys, welcome to our webinar on Ozempic and BFR training and how to prevent muscle loss, which is the biggest risk or downside of using Ozempic or GLP-1 medications. So this is a little bit of a different topic for me. I haven't really talked about weight loss medications before. I'm certainly not an expert in them. What I do know about them is they can be very, very useful and helpful for the right situation, the right person that really has health risks related to weight that need some additional help in losing the weight. So they can be a really good tool with the right medical advice and under the right guidance. But what I'm passionate about is helping people stay healthy for the long term, and muscle mass is a really, really important part of that. And we're going to go into a little bit more detail today on why that is true. Muscle mass, of course, it's what you think of, to be strong and all that, but it has such a bigger role in our body besides just strength alone. So we're going to dive into that a little bit. So I'm going to go ahead and share my screen for my slides, and then we'll get some discussion at the end, bringing you guys all back. All right. Okay. So Ozempic and BFR, how do we combat muscle loss when using these medications? And I say Ozempic as a generic term, but really it's the GLP-1 category. There's Wegovy. There's lots of different types of medicines in this category. So we are really just using that as an overarching term. So muscle loss is really one of the biggest risks of GLP-1 medications. They're starting to realize this more and more. They've done a bunch of different studies, and numbers are a little bit all over the place, but on average, 40% of weight loss on GLP-1s is lean muscle. Now, that's a huge percentage. Now, anytime you lose any significant amount of weight, lean mass you're going to lose lean mass as well. But we want to minimize the amount we lose lean mass. 40% is a really big amount. And there's even some studies that have shown this number to be as high as 60%. So I've just kind of averaged out what people are seeing out there. And this is kind of a newer, they're realizing this, these medications are relatively new, especially being used in the wide ranges being used now. And this is somewhat new in the last few months, what they're really realizing that this is one of the big downsides. So let's talk a little bit more about, first, this is another graph to show you in a different way to talk about 40%. This is a graph of the dotted line shows how much muscle mass you would typically lose over 10 years. The red line is on average how much muscle mass is being lost in 1 to 2 years on GLP-1s. So you're losing muscle in 1 to 2 years that would normally take 10 years to lose. So that's really, really fast. Yeah, Maureen, I see your expression. That's really fast, and that's way too much in a short amount of time. As we age, muscle already becomes difficult to maintain, and so we don't need any extra encouragement of losing it quickly. So this is something we want to be aware of and combat. So why do we care so much about losing lean muscle? It's not just impacting our strength, although strength obviously is important in and of itself. But muscle is really the foundation of our metabolism. So without muscle, our metabolism really begins to decline. And that's both speed of metabolism as well as health of metabolism. You've maybe heard metabolic disease or metabolic disorders are becoming much more common. That's type 2 diabetes or pre-diabetes is on the rise. This is because we don't have healthy metabolisms. We do not have a place to store our insulin. If we lose muscle, we have less places to put our insulin. So we get more insulin resistance, which equates to diabetes or pre-diabetes or poor metabolic health. So losing lean muscle, if we have muscle, we will decrease insulin resistance. We prevent frailty. Sarcopenia is a very specific term that represents a lot of muscle loss as we get later in life, but it's a very bad health issue of having low muscle. But even if you're not technically have sarcopenia, frailty is an issue. And by frailty, I mean not just muscle, but bone density. Bone density is related to muscle mass. The more muscle we have, the better our bones are going to be. And if as we age, you've heard a lot about risk of falling. Falling when you're frail, bad combination. The other thing muscle does is it prevents falling. The more muscle we have, the better balance we have, the more strength we have to support ourselves. So it's also fall prevention. And then another really important thing is when we have muscle, we have more energy and vitality. So really, it's the foundation of so much healthy functioning of our body. Okay, so it's not just impacting our strength. In other words, if we gain or maintain lean muscle, it's going to not only improve our metabolism, it is one of the most linked things to our longevity. So healthier muscle, having more muscle is going to increase your health span or improve your longevity and also improve overall health. So more muscle equals faster metabolism. As we age, it's common for people to start gaining weight. Have you heard of like gaining weight around your midsection? Have you experienced that at all? That's common as we age, especially for women. As we go through menopause and we lose our estrogen, we're more likely to gain weight around the midsection. The more we can hang on to our muscle, the more that's going to fight against that natural weight gain as we get older. So more muscle is going to increase faster metabolism. I also mentioned this before, but I want to explain this a little deeper. Muscle is our primary place that our body stores glucose. So when we eat food, carbohydrates, or sugar, it gets turned into glucose. It travels in our blood and our body needs to put it somewhere. Glucose is a form of energy. So it's in small amount of doses, glucose is really important for us. It's where we get our energy. Our type 2 muscle fibers use glucose for energy. The problem is with our diet and just kind of the culture of our food, we get a lot of things that digest quickly, a lot of processed foods. We get too much glucose in our blood. If we have more muscle, we have more storage for glucose. Think of it, your muscle as the closet for glucose. The bigger the closets, the more glucose you can shove in there, right? Once our closets get full, we have to start putting that glucose in our liver, which is not good, and our pancreas and other parts of our body. It stays in our blood longer. That's when we start getting insulin resistant. Our insulin is no longer working. Insulin is what pushes the glucose into our muscles. But if there's nowhere to push it, insulin no longer works and our body becomes resistant. This is the beginning of metabolic disorder, pre-diabetes and diabetes. So muscle gives us not only a place to put it, but then when we're working out and doing strength training and using our muscle, especially our type 2 muscle, we burn that glucose for energy, creating more space for our body to put it. So really, really important for metabolic health, for managing blood sugar, is keeping muscle and doing strength training. Muscle is also correlated with bone health. Bone health has been talked about a lot lately, especially again for women postmenopausal. We lose estrogen, our bones get affected by that. It's almost becoming an epidemic for women, the amount of osteopenia and osteoporosis that women are experiencing as they age. The more we can hang on to our muscle and the stronger our muscle stays, we are going to have stronger bones. Think about it. There's not going to be someone who's really strong and sturdy, but that has frail bones. The frail bones is going to be the people that have lower muscle, right? So we want to maintain our muscle for bone health. Healthy muscle also improves at the cellular level. It improves our cellular function and it improves mitochondria. Mitochondria is the cell in our body responsible for taking oxygen to our blood and putting it into our muscle for energy. So literally when your mitochondria are functioning better, you have more energy. It is easier for your body to produce energy. So when your muscle tone improves, when your muscle strength improves, your cellular function improves, you have more energy. This is super important as we age. Energy and vitality is a big thing that people say as they get old that they want. They want to maintain that vitality and energy. And for all these reasons, it should maybe seem obvious by now, but healthy muscle is literally going to increase our health span. Health span really means the amount of years you live in good health. So we talk about longevity, how long will we live, but health span is how many of those years will we live healthy. That's what everybody wants, is a long health span, and healthy muscle is directly linked to increasing our health span. So lots of good reasons to maintain muscle. The challenge is, or the problem is, It's difficult to build muscle as we age. It takes a lot of hard work. It takes knowing how to lift heavy. Um, and some people just aren't able. I myself had a hip replacement at 43, which was really young. And even though I was an athlete and knew a lot about lifting, I no longer could lift as heavy as I used to be able to, and I started losing muscle. This happens to everyone. As we age, our joints just cannot handle the load, the high stress of heavy load, because we don't have as much cartilage. We don't have as much protection and padding between our bones. So heavy load becomes harder to handle as we age, or if you have injuries. So this is where blood flow restriction training comes in. Those of you who have followed me or who work with me are very familiar with blood flow restriction by now, but to just talk about it, if you haven't heard of it, it's been scientifically proven to be the best solution to preserve muscle without having to do heavy lifting. That is huge. That is a huge statement, because up until the development of blood flow restriction training, heavy lifting was the only way that we knew to gain muscle. And as I just said, that is for some people impossible, very difficult, leads to other injuries, leads to aches and pains, and maybe just be too big of a mountain to climb for people. So this gives a really solid science-backed solution to gaining the same amount of muscle we can with heavy lifting, only using light weights. How does that happen? The blood flow restriction training, we put bands on our arms and our legs that reduce blood flow, reduce venous blood flow to the working muscles. This creates hypoxia, which just means low oxygen in our muscle. Hypoxia, you can even Google it, leads to long-term hypoxia is obviously not a good thing, but short-term hypoxia leads to our body responding in all these amazing ways because it's thinking we have low oxygen, we want to reverse that. So it improves vascular health, it improves metabolic health, and it builds muscle. Cellular swelling is another proven research way that we get stronger. So by having the bands on, our cells actually get more full of water and fluid. This causes swelling, and that creates a bigger cell to be stronger in our muscle. And the last one is it increases the metabolites in our muscle that lead to muscle growth. So these are anabolic metabolites like human growth hormone, IGF-1. The metabolites is actually lactate, but it leads to the response of human growth hormone. Blood flow restriction training has also been scientifically proven to increase natural human growth hormone. So human growth hormone, as we age, declines. I've talked about this a lot before, and it's a super important point that human growth hormone is a fantastic hormone that keeps us strong, keeps us mentally sharp, keeps our bones strong, helps us manage our body composition and our body fat, gives us more energy, and it steadily declines as we age. And only real way that we increases it is through exercise. But just the same as building muscle, it used to be that you had to do really hard, heavy lifting to get a human growth hormone response. Blood flow restriction training, short workouts with light weights have been proven to give the same, if not a greater response in human growth hormone. So to me, this is the number one reason that blood flow restriction training is so powerful, is because of this robust release of human growth hormone naturally that we get. If you've heard of any risks of human growth hormone, that is all from synthetic human growth hormone that is injected. There can be risks with that, but if it's being naturally produced from your body, that does not pose those health risks. It's very good for you. Human growth hormone will reduce fat in the midsection. So when estrogen declines during menopause, so does human growth hormone. If we can get a rise in human growth hormone, we're going to combat a lot of the symptoms of menopause that have been thought of as being low estrogen, but a lot of them are actually low human growth hormone. So reducing fat in the midsection through increased human growth hormone is a great benefit of blood flow restriction training. And as I mentioned, it improves brain health by improving circulation, creating more capillaries in our brain. It improves bone density, muscle mass, and energy, as I've talked about, improving the mitochondrial health. So lots of benefits of BFR. And the real key here is you can preserve your muscle and get all these benefits without having to lift heavy. And that is really where the game changer is for so many people. People who are maybe on Ozempic or GLP-1s or thinking about it may have had a history. If you've had a history of being overweight, working out and lifting can be very not only challenging, daunting, it could feel not good on your body. It may not be good for your joints. And so this is such a good solution if heavy lifting has not been possible for you in your journey up to this point. So combining Ozempic and combining blood flow resistance training can be optimal for your health in that I think what the great thing about Ozempic and GLP-1s, and as I said, I'm not a doctor and you should get medical advice because it's not for everybody, but if it's the right person, it makes something that feels hopeless, like losing a lot of weight can feel hopeless. And you've tried and you've tried and you've tried diets and you've tried and nothing works or nothing's sustainable and it feels hopeless. Well, Ozempic and GLP-1s make it possible and make it feel possible, and you have success. And then this creates a whole new path of possibilities for people to actually make more lifestyle changes. You have more motivation, you have more hope, you feel better in your body. Now you can start moving more. Now you can start you're more motivated to make the lifestyle decisions that are going to help you be healthier because Ozempic or GLP-1s have given you some success. BFR is very similar in this way, and that gaining muscle and strength and bone density can feel daunting. It can feel impossible at times. I know when I was recovering from my hip replacement, it felt literally impossible to gain muscle. I would work out as hard as I could, and then my body would be in pain and miserable. And then I wouldn't work out so hard and I would lose muscle. So I felt like I was in an impossible situation. BFR makes the goal of gaining muscle achievable and accessible to so many more people. So when you combine Ozempic and BFR, you're giving people success quickly and much more easily, which is a huge boost in motivation, positive momentum, and it gives back hope and confidence of your future. I felt, I have not struggled. I have not a weight loss struggle. I have not used Ozempic myself, but my struggle was my lean mass and having hope in my long-term future because I felt like my body was broken. And that is a pretty devastating thing to feel like you're stuck in a place in your life, whatever it is, that you can't overcome. And I will just say for me, BFR was the thing that gave me the confidence and hope again that I could overcome what the challenge in front of me. And so that's what I hope with those people that are looking at Ozempic, GLP-1s, and having that weight loss struggle and are working to get healthier by losing weight, that BFR can be a nice combination with that to allow you to prevent the biggest downside of losing muscle on Ozempic. And you can actually easily maintain and also gain muscle as you want with BFR in a way that is a much easier hill to climb. The last thing I'll say, and then I'll open up to discussion and questions, is I started a company, Selly Strength, a year ago. And the reason is because this BFR and that program changed my life. And I set out a mission to make maintaining muscle mass simple for people. I have been a trainer for 30 years and I've seen people struggle with their health and their weight because heavy lifting can be too hard on your body. So I wanted to make a program that made this simple for people. We start with just 2 BFR strength workouts a week that are 25 minutes each. You have light weights, minimal equipment, and you can do it at home and on your own time. So we remove almost all barriers to strength training. It's not dangerous. It's light. You can do it on your own time. It's short. It's quick. It's doable. And the big thing that's different about us, we're not a streaming service, but we're a personal training platform. We provide coaching. We provide live instruction. We provide a specific program that you follow each week, taking all the guesswork out of what you need to do. So if anyone's interested in learning more about that, you can reach out to me. We have a promotion, $100 off the first month, if that's something you're interested in. But mostly today, I just wanted to open up people's eyes about what BFR training is, what it can do, and for the topic today, specifically how it can support someone on an Ozempic or GLP-1 weight loss journey. So with that, I will stop sharing my screen and any of you can come off mute and we'll go through some discussions or questions. So Questions, anyone? Maggie.
Would you recommend, I'm typical, I'm not middle-aged anymore. I'm a little over that, but you know, I'm an active person. I do BFR, I lift weights, but there's this stubborn 10 to 15 pounds that I just can't get off. And it's tempting when you see everybody around you using this GLP-1. So that's why I'm really interested in what you had to say, because the last thing I'd want to lose is muscle. But if you already have muscle and you're on a regular routine, would you say that that loss wouldn't be as much, that muscle loss wouldn't be as much as if you're maintaining that exercise and taking GLP-1?
So for sure that if you're taking GLP-1 and you're doing strength training at the same time, you're not going to lose as much muscle as if you aren't doing strength training. Also, protein becomes an issue. You lose your appetite when you're on a GLP-1. So you need to really make sure you're prioritizing protein. I'm not necessarily being a proponent. I'm not necessarily encouraging people to
Yeah.
use GLP-1s. I'm just saying if people are for their own health reasons, they need to be paying attention to their muscle. That's really my message today. If
Yep.
you're interested in exploring it, that would be something to talk to your doctor about.
Yep.
I know what most people say is it's going to be more based on your health markers, blood
Mhm.
markers, health risks than how much weight you have to lose. But every doctor has a little bit different opinion. Every patient has different goals. But that's a little bit out of my scope. So I just
Yeah.
don't want
Yeah.
to,
Yeah.
directly talk to
No, I
that. But yeah,
appreciate the way you presented it because you made it very clear that you're not a proponent of it, but the information is what I was after. So that's good.
yeah.
Good.
Yeah. So the key is if you are going to do those for whatever reason, just prioritize your strength training and your protein.
Yeah.
Those are going to be your two things while you're taking those medications to minimize this downside. You still lose some lean mass, and losing little is okay. You just want to make sure you're um, not losing too much. And if you only have a little bit of weight to lose, it's going to be proportionate, right? I'm more talking about people who have a lot of weight to lose,
Right.
and then a high percentage is lean mass. That ends up being a lot of lean mass, and that becomes hard to overcome, especially as we age. When we go into a lean mass deficit, we don't have much muscle, we get in this downward spiral of now our energy is low, now our metabolism is low, and now it's why people have a hard time going off of these drugs, because their metabolism has slowed down. So
Yeah.
now they have to eat less than they did before, and then so it becomes this almost vicious
Yeah.
cycle if you're not being um, cognizant of prioritizing muscle and prioritizing protein. And one of the reasons why I think BFR is a great solution is because if you're on a weight loss journey like that and you haven't been doing strength training, it can be really overwhelming to start and just like, oh gosh, another thing I need to do and I don't know how to do it or how to, And so I'm just trying to say it's not. Let's start with a real easy solution that's going to get you results quickly so you can stay on a positive path.
Yeah. Exactly. You'd have to make yourself eat.
Yeah. Yeah. The protein. Exactly. Yeah. Maureen, I saw you came off mute. Do you have a question?
Yes, I do. Do you know for the studies about the GLP-1 and the muscle loss, what was the dosage of the medication?
That's a good question. From what I looked at, I was kind of an aggregate of a bunch of studies, and 40% was kind of the average. Like I said, some were as high as 60%, and then some were lower. But you can Google that, and I can also look it up. But there's so many different studies, like it would be hard to say what one was. But I know that one of the ingredients, I'll have to look it up, was known to give a higher loss of muscle. Um, so it is something to pay attention to. I can get you more information offline on that, Maureen.
Yeah, and then also there's like, for example, one medication is called Manjaro. It advertised that it has two ingredients to lose weight, where I think Ozempic has only one. So I don't know if that at the end it makes a difference in the weight
Yeah,
loss. I mean, in
there
the
is.
muscle loss. So
Yeah, there is an ingredient. Do you remember what the ingredients are in Manjaro? Do you remember what they were? One starts with an S. I'm blanking on it. I was looking at it right before this call. And, Emily, can you look it up? It starts with an S, and it's one of the ingredients in the weight loss drugs that it is shown to have a higher loss of lean muscle than some of the others.
Okay.
Hmm. I'm blanking on that. I'm going to jump over to Elaine, and then maybe someone will get me that info for us.
Thanks.
Elaine, you had a question. You can unmute.
Here. Okay.
There you
Yeah.
go. There you go.
Is it semaglutide?
Thank you. Yes, that is right. Semaglutide.
Yeah, that wasn't my question though, but I just popped in my head.
Thank you.
Yeah, so I work with patients that are, also getting their cardiovascular care, and some of them are on GLP-1s, and we focus on them making sure to do their strength training while they are. And some of the questions have been really good that have come up from them. So I wanted to ask you, like,
Oh, great.
let's say, someone has had a cardiac event and they cannot raise their heart rate above let's say like no more than 50% of their max heart rate. Let's say like they really have to keep their heart rate down. And this might be somebody who was a former athlete and they have the ambition, and they're frustrated now because after they had a cardiac event. But would BFR be a potential solution or not, given the heart rate question
It's
that
a
they
good
have to
question.
manage?
It could be a solution. What I would do in that case is like I would do upper body only, and I would do isolated work to isolate muscle groups to burn out and gain muscle. But I would not do like full body dynamic systemic where you're getting heart rate up. So you could even do legs, but I would just do I'd do leg extension, leg curls, like calf raises, like really almost like bodybuilder one joint muscles, so that we get minimal heart rate increase, but we're getting maximal muscle fiber kind of recruitment, if that makes sense.
Okay, awesome. Yeah, thank you.
Sure. Did you have another question there, or that was the main one, Elaine?
Well, the other question really is, I think we've talked about this before, but it might be good to actually say here is, what about people that are managing their blood pressure, right? And they, obviously come to us and they get medication and they're working on managing it. But what is recommended from your perspective, if you were to get a client that said, I've had hypertension, I have a doctor, but let's say my numbers are still hypertensive, when would you be okay and feel safe in them starting BFR?
Yeah, so that's a great question. If they have high blood pressure and then they're treating it with medication, then they can do BFR. I would start, if they're deconditioned, and that's part of the reason why they have hypertension, then I would just start them slowly, just like you would any exercise program, right? You're gonna ease them into it. You're gonna do low intensity first, shorter amount of time. So that with the BFR, you would start with short amount of time wearing the cuffs, lower intensity exercises, and then gradually build them up. And then over time, they might actually, it's been shown time and time again, and I have this personal experience, even though I didn't have high blood pressure, my blood pressure has lowered as I've used BFR, because it makes sense. It's making our vascular system more efficient and healthier and more flexible, which is the opposite. When we have high blood pressure, our veins and arteries start to stiffen, and that's what creates the higher pressure. So we want flexibility, and BFR promotes that. So it can be actually a really, really healthy thing for someone that has high blood pressure. You just want to, be conservative as you start them on it, I would say. Great questions. Love those. Anyone else who hasn't asked a question yet? Inger or Roger or Emily, you guys have any questions? No, Inger, you're good. Good to see you, by the way.
Yeah, thank you. I apologize. I jumped on too late.
Yeah.
So I'm just going to wait for the recording to come out.
Okay. Sounds good.
a lot in the first 20 minutes. And yeah, I'm super curious. I'm on here to collect as much information. I have a lot of friends who have gone on it, and they're actually like, "Oh, you're sitting on a webinar? Let me know what you learned," because I think they're experiencing some muscle loss, but direction to find the information. So I'm not going to ask any questions yet. I'm going to wait for the recording to come out, and then I might hit you up a little later.
Perfect. That sounds great. That sounds great. Yeah, it's yeah, I think the point is people are becoming more aware that that is a downside, and then it's like what to do about it. So I was just offering educating on how BFR can be a really good tool for that, and just being aware that that's if you're going into using GLP-1s, that that's going to be something you want to really pay attention to. So protein is the other thing. So focusing on the protein nutrition side, which is going to be harder when you're on a GLP-1 because you're going to have a lower appetite, and then prioritizing strength training. And if you do those two things, and BFR is just the simplest, fastest, lightest way to get the strength. Elaine, yeah, you have another question?
Yeah. So another thing that keeps coming up, because a lot of people, right, have body dysmorphia issues, or they have, mental, maybe mindset or eating disorders, whatever, and they haven't been able to handle their weight until they use Ozempic or Wegovy or Mounjaro, whatever. So when it comes to measuring weight, there's this mindset of like, I have to lose weight or my weight loss is what matters. But what I want you to touch on, when you're building muscle, your weight may not drop as fast. And so how would you, from the maybe psychological perspective, manage someone or help someone who's like, all right, I want to do this better. I want my health span to improve, but they have a attachment or construct in their mind that losing weight is like their measurement of success. So could you touch on things that like even how we measure success in fitness versus like medical, like sometimes they come from the perspective of what's my BMI versus body fat percentage, or like what are some ways that you could help someone with gaining muscle but not being caught up in that diet
super good question, because that's really true. And especially as we're talking about the importance of, maintaining and ideally gaining muscle for a lot of people, because a lot of women are already under muscled, right? So you're right. So we don't want to just look at weight. And I think a DEXA scan or a body fat composition measurement is probably the gold standard to really know what's happening with your body, because also it's bone density it will change how you weight. Not a huge amount, but can be within a few pounds, depending on your bone density. And water weight and other thing, which is actually healthy. When you get cellular swelling and your muscle is drawing fluid into your muscle, that's actually a good thing, and that's healthy, but that's more water weight. It's going to come up on the scale as maybe more weight, but it's good weight. So I do think we need to get away from just weight on the scale. One kind of trick, kind of shortcut trick is you can weigh yourself and you can do waist and hip measurements. And that's kind of like the kind of shortcut version of kind of doing a body fat measurement. Is obviously not going to be as accurate as doing a DEXA scan or a body fat measurement. But if your weight, let's say your weight goes up, but your waist and hip measurement stay the same, you haven't put on body fat. Or if your weight stays the same, but your waist or hip measurements have gone down, you've lost body fat. So that can be just a nice quick, if you're mostly just relying on the scale, that can be a nice quick double check. Also, our body fluctuates depending on, cycle. If you're still menstruating, like that, our body's going to change. And also through different phases of exercise, our body's going to change. So obviously we want to watch long-term trends and make sure we're going in the right direction. But like everyday weighing and like making decisions based on that is not really the best method or healthy, as you're saying, Elaine. Is like being so attached and so focused on that can actually get in our way versus focusing on the it's kind of like behavior goal versus outcome goal. Instead of the weight being your outcome goal, focus on your behaviors. I'm eating my protein. I'm not eating processed foods. I'm doing my cardio. I'm doing my strength training, or whatever it is in your goal. Focus on those, knowing you're doing the right thing, and then look at your longer term trends and try to avoid the noise of the short term possible, up and down. I don't know if that was helpful or not, but that was a good question because that is true. Roger, I don't know if I think you're listening in. I know you came in a little late, so I think you missed the presentation part. But if you have any questions, happy to hear from you, but no pressure. All right. Anyone else? Maureen, you have another question?
Yeah, so I just wanted to go back to that question before. So the semaglutide is the one that increased more the muscle loss. Is that it?
Yeah.
So the higher dosage of that, the more muscle loss you would lose?
Yeah, there was a study that showed 60% of weight loss was lean mass. Now I'm not an expert. I, again, would talk to your doctor. I haven't looked deeply at every study and all. I've just looked at general reviews of the studies and what they're finding, and I kind of looked at more like collaborative data, not getting as specific as that. But I do know that one had a higher muscle loss. The average was around 40%. Some drug, and it's not just the drugs; it's the person, it's where they're coming in, it's what they're eating. So it's not every person is going to have the same response. But the point is, you're going to be at more risk for muscle loss than you would if you weren't using a GLP-1. And because you're losing weight more quickly, muscle mass tends to drop more quickly. And so we need to take steps to maintain muscle through protein and strength training. So that's really the message. You're going to lose more. You want to combat that with your behaviors while you're on those medications. But good questions for your doctor. If you're on them or considering, you definitely want to get more of these. It's a great conversation to have with your doctor to get more information. Well, what does this drug do versus this drug? And I care about my lean mass. So which drug is, that might be something good to have a conversation with your doctor about to get more in the weeds on that topic. Yeah. I love these discussions. It makes me feel like people are in, engaged and into the content. So I appreciate that. Sometimes it feels when you're doing a presentation on Zoom, it's like, how are people perceiving this? So it's good to know you guys have some good questions out there. Anyone else before we wrap up? All right.
I do real quick. Yeah.
Okay. We got 2 left. All right. Maureen, go ahead.
Okay, so do you, I don't want to do a DEXA too often and so on. I've done one before. I'm going to do one again since I've been doing BFR for a while now to see the difference. But is there a way do you physically feel that that you have built muscles or not?
I mean, if you're in tune with your body, like I can tell when I've gained muscle versus body fat, like I know where I gain body fat on my body, and I know, so you can kind of feel like, do my muscles feel firmer? Do I have more tone? Do I feel leaner? But it's not going to be an exact science, but you can kind of get a general idea. Sometimes people say how their clothes fit, but it partly depends on where you store fat. Some people store fat like more specifically in one spot, and some people store fat more dispersed across their whole body. So that's harder to tell as well. So yeah, you can do that. You also can do there's some easier like bioimpedance tests, and you can even buy scales that are not that expensive that measure body fat. Now, you'd have to do a little research on how accurate they are. Some are more accurate than others. They can be sensitive to how much how hydrated you are or not. But I think they're getting better. So there are scales out there that you can just get for home that are maybe $100 or in that price range that will measure your body fat percentages.
Thanks.
Yeah. Elaine, did you have another thought?
Yeah. My question is, since I know you're doing this study with women, do you have any women who have self-identified that are on a GLP-1? And do you know if there's any studies that have been done with women who are on GLP-1s and are working with BFR? Or are we on the cutting edge trailblazing as well?
I think we're on the cutting edge. That's a good question. I'll have to search again, but I don't think there are any studies specifically on BFR and GLP-1. Lots of studies on BFR on how effective is increasing strength, but I'm not sure it looks at with GLP-1. I do know at least one person that's on GLP-1 in our study, and she's had great success. Well, we don't have a lot of people doing DEXAs just because it's difficult, although I have more people now joining the program that are doing DEXAs. So I'm excited to get that information over time. But we are having them do strength testing, weight, and measurement. So we can, between those three things, if your strength is going up, we'll see where your weight is. And then what happens to your measurements, we can kind of make educated guesses on, did you gain muscle? Did you lose fat? What happened? But yeah, the DEXA would be, I would love people to take a DEXA right before they start and see. So Maureen, if you do a follow-up, I need to hear all about it. You're muted, but you're muted, Maureen.
Sorry. I did do a DEXA, I think at the beginning of the BFR. So I might be a good candidate for you to know the difference.
Exactly. Keep me posted.
Okay.
All right. Well, this is great. I appreciate all of the questions and interaction, engagement. And I'll send out the recording, Inger, probably later today or tomorrow. And reach out if anyone has any questions at any time. Always happy to help. And our next webinar, Maggie, is going to be on brain health. So that'll be a good one.
Thank you.
Not to isolate Maggie. We've talked about that in the past. So I know that's something she's interested in.
True.
Yeah. All right. Thanks, guys. Look at that.
Thank
Right
you.
on the dot. 45 minutes. All right.
All right.
Have a
Thank you
great
so
day,
much.
everyone.
Thank you so much.
Okay.
Thank you. Bye-bye.
Bye-bye. Thanks, Elaine.